Hi, how are you? My name's Nadine. I'm a student physical therapist. How are you doing today?
I'm doing alright.
You're very good. All right, so what we're going to do today is something called a goniometry measurement using these tools right over here. So what that means is I'm just going to take a range of motion measurement from your hip, knee, and ankle, and it's all going to be on the left side. And just to reiterate this, I'm just going to tell you this is going to be for educational purposes, so it might be seen by my teachers and peers. Is that okay with you?
Yes.
All right. So also, because she is a minor, I got consent from her father before beginning this, so we are able to do the measurements. All right. So again, we're gonna do everything on the left side. So sometimes I'll just verbalize what you have to do, but if you're not understanding something, I'll demonstrate it for you.
Okay.
Or if I feel like it's a little hard, I'll physically do it for you. But I want you to do everything on your own without my help. Okay?
Okay.
All right. So for the first measurement that we're gonna do something called a hip internal rotation. So what I'm gonna do first is I'm gonna put this towel underneath your knee so that way you're properly aligned for the measurement. There you go, good. And what I want you to do during this time, I'm gonna stabilize you with my hand, so it's gonna prevent you from moving incorrectly. But I want you to try to sit up nice and tall for me. I want you to not bend at your trunk during this time, and I don't want you to lift up your hip.
Okay.
All right. So I'm going to show you the motion right here. So what I want you to do is I want you to bring your ankle away from you. So right there, okay?
Okay.
All right, so let me just line it up real quick. And I'm going to put my hand here, okay?
Okay.
All right, so on the count of 3, I want you to try to do that motion on your own. Try to bring your ankle towards me, okay?
Okay.
On the count of 3. 1, 2, 3, and go. As far as you can, as best you can. There we go. Try not to don't lift up the knee, okay? There you go. And hold that position. Try to keep up. Keep up. We have 28 degrees of internal rotation for you. All right? Very good. And now, what we're going to try now is we're going to go the opposite way. So we're going to do hip external rotation. So what I want you to do is just bend this a little bit, not too much. I don't want you to lean forward too much, okay? What I want you to do is I want you to bring your ankle towards the window, okay?
Alright.
Alright, so I'm going to stabilize you here again. So, I'm going to put this right here. I'm going to put my hand right over here, okay? So what I want you to do is I want you to bring your ankle towards the window, okay? On the count of 3. 1, 2, 3, and go. Hold it right there. Any more? There you go. We have 28 degrees of internal rotation, hip internal rotation for you. Okay? All right, so that's it for sitting right over here. The next one, I'm going to have you face down, lie on your stomach, and you can put your face through this hole right here, okay? Actually, let me see. Yes, we'll be fine. All right, thank you very much. So, let me just see here. I'm just going to check for a landmark, okay? So I'm just going to put my hand on the side of your hip, okay? Alright. So can you turn your leg in and out for me? Okay. More up here. Alright, very good. And relax. So what I want you to do, so on your left side. Actually, this is your right side. So I'm going to do it on the left side, which is the correct side. Okay? Sorry about that.
No problem.
Okay. So we're going to try this again. I'm going to try again what I did before. So turn your leg in and out for me. Try to roll. There we are. Okay? Alright. So I'm just going to put my hand kind of right over here. So I don't want you rolling your hips towards any side, okay? I want you to keep your pelvis on the table, okay? What I want you to do is, and that's going to be a little difficult, so I'm going to show you the motion. I want you to keep your knees straight. I want you to lift up your leg towards the ceiling. So try to keep your knees straight, lift it up. Try to lift it up, like that.
Oh.
Yes.
Oh,
okay?
okay.
Yeah. All right.
I thought it was this.
No, that's a different motion. Okay.
Okay.
So what I want you to do is I want you to try that motion on your own without trying to rolling your hips to the side. Okay. On the count of three. 1, 2, 3, and go. All right. Try to keep that there. There you go. Good. Okay. We have 20 degrees of hip extension. Okay, very good. Good job. All right?
Mhm.
Feel okay?
Mhm.
All right. So now you could lie on your back, all right? So we're still doing the left side, all right?
Okay.
I got it.
This is mine now.
Here, I'll get you a pillow, okay?
It's fine.
Put it under your head. So, there we are. Okay. So come a little towards me. Alright, so now I'm going to try this again. So I'm just going to check for a landmark here. Can you turn your leg in and out for me? Right here. Alright, good. So for this motion, we're going to check for your hip flexion, okay?
Okay.
So I'm just going to put my hand right here so that way I don't want you to arch your
Mhm.
back and I want you to keep it flat on the table, alright? So what I want you to do is I want you to bring your knee towards your chest. Can you do that on your own?
Mm-hmm.
Alright, so on the count of 3, 1, 2, 3, and go. There we go. Okay, good. Any more than that? We have 105 degrees of hip flexion for you. Okay? Feel okay?
Mm-hmm.
Alright. So that's it for the hip. Next is going to be for your knee, okay? So what I want you to do, just slightly bend your knee for me. Good. Good. And back down. What I want you to do is I want you to bend your knee. Bend your knee. And what we're going to do is we're going to bring your heel towards your butt like this, okay?
Yeah.
Alright?
Mm-hmm.
Very good. Alright, just go nice and easy with that, okay?
Mm-hmm.
Alright, on the count of 3, try that on your own. 1, 2, 3, and go. All the way. Any further than that?
Mm-mm.
So we have 138 degrees of knee flexion for you, right?
Okay.
Alright, so now we're going to check your ability to straighten out your knee, which is what we call the extension, okay?
Mm-hmm.
I'm going to put this towel roll underneath your ankle. Sorry. Alright. Feel okay?
Mm-hmm.
Alright, so I want you to keep that knee pointed towards the ceiling. Alright, so what I want you to do is I want you to bring your knee down towards the table on the count of 3, okay? Try to straighten it out as best you can. 1, 2, 3, and go. Okay. Any more than that? That's good. So we got 2 degrees of knee hyperextension for you. Alright?
Mm-hmm.
So relax. Feeling alright?
Yeah.
Alright, so we're gonna try now. I'm gonna get a different towel for you. We're gonna try to get some measurements for your ankle now, okay? So what we're gonna do is we're gonna actually have you slide down until like your ankles are slightly off the table, okay?
Okay.
Yeah, just try a little more. Just a little, not too much, okay? Okay. So, and I'm gonna put this towel roll underneath your knee, okay?
Okay.
There you go. Lift up. There you go. Alright, so we're gonna focus on your ability to bend your ankle up toward bend your ankle. So we're gonna bring your foot up towards your head, called what we call ankle dorsiflexion, okay? So let me just try here. So again, I want you to bring your foot up towards your head, okay?
Mm-hmm.
Alright. On the count of 3, try it on your own, okay?
Mm-hmm.
1, 2, 3, and go. Lift up, lift up, lift up. Any more than that?
No.
So we have -4 degrees of ankle dorsiflexion. Alright?
Mm-hmm.
So the next one is going to be going the opposite way. So we're going to point your foot down towards the ground, okay?
Okay.
Alright? Let me just realign this real quick, okay?
Mm-hmm.
So on the count of 3, I want you to try to do that on your own, okay? On the count of 3, 1, 2, 3, and go. Point down towards the ground. Try not to lift up too much here. Just all at the ankle. So we have 60 degrees of plantar flexion for you, okay?
Okay.
Alright. Is that okay?
Yeah.
Alright, good. Alright. Alright, so the next one is going to be testing your motion to turn your foot inwards towards your opposite foot.
Okay.
So we're going to we call that ankle inversion, okay?
Okay.
So let me just find that here. Alright, so again, what I want you to do is I want you to turn your foot in towards your right foot, okay?
Mm-hmm.
On the count of 3. 1, 2, 3, and go. Any more than that?
Mm-mm.
So we have 44 degrees of ankle inversion for you, right?
Okay.
So now what I want you to do is I want you to go the opposite way, all right? So I want you to turn your foot out towards me, okay? On the count of 3. 1, 2, 3, and go. Any more than that?
That's it.
Okay. So we have 15 degrees of ankle eversion for you, all right?
Okay.
All right, so that's all the measurements for today. Do you have any questions or concerns for me?
I do not.
All right. Thank you very much.
Mm-hmm. No problem.
Thanks.